So you're going to see EMDR treatment of a case of simple whiplash pain. And this is a woman who has been in a motor vehicle accident which involved a violent collision with her car, and who developed whiplash pain and acute stress disorder. It's too recent for it to be PTSD as a result of that accident. And you'll see the processing of the trauma and the pain literally in a matter of minutes, and the complete resolution of both. Now, this is not a typical pain management case. Most cases are much more complex and involving attachment problems in childhood, and emotional neglect, and physical or sexual abuse, various other health problems, adult trauma, current life stresses, and so on. The purpose of, and they involve and require a much more integrated, lengthier treatment process. The purpose of showing you this video clip is to give you a kind of a quick and a simple overview of the way EMDR works, and the key elements of the process, which is essentially the processing of past trauma to resolve present symptoms. But I emphasize that in most cases of chronic pain and medically unexplained symptoms, there's much more going on than is portrayed in this video. For example, people not only have had histories of severe trauma and adversity, they're often exhausted, and the system needs much more stabilization and resourcing before they could experience anything like the changes that you see in this case. So please tell me a bit about your pain.
It's down the right-hand side. It's muscle, my neck, my lower back, my shoulder, elbow, my wrist, my fingers, my hip, my knees. So it's all just down that side. But the worst pain is in my back and my knees.
And what did the doctor say is causing the pain?
Whiplash. He sent me to the doctor and he said I have a strained back.
So what happened?
Well, I didn't even see the truck coming. He was in the right-hand lane going back into the left lane, but he was behind me and it was raining torrentially. So I was watching the cars in front of me and he hit me from behind. And by the time my mind had registered that something was wrong, I was already turned around in front of the truck, being pushed. I had no chance to work out what was going on. And I lost 3 friends last year in a head-on with a truck that were coming to visit me. And then they were here and they were late, and we tried to call, and then we found out through the police service and through Facebook that all 3 of them had died in a head-on collision with a truck. And I went up to Armadale for the funeral and everything. It was very traumatic. They were quite young. And the first thing that came to my head was that I was going to die like Scott and Jane. And I didn't.
But you believed you were going to die.
Absolutely. There was no thought that I wasn't going to die. I said goodbye to my kids. I had that time. I don't know how, but I did. And in my mind, I saw my kids. And I said goodbye to them. And then all of a sudden, I came out in front of the truck.
So what was the worst moment of the accident, Joanne?
In front of the truck when I was screaming. I can hear my scream very clearly still in my head. I've never made a noise like that in my life.
You were scared, terrified.
Absolutely. I have never even known that terror like that existed. And That's what keeps coming into my head every time I close my eyes. Someone could be talking to me and I'll like zone out and it'll come into my head.
Is that the major problem? More than the pain?
My mental problem is much more than my pain. I can handle physical pain. I feel like my mind has been shattered into a million pieces.
Okay. So it's the mental side of things that's bothering you the most.
Yes. I've had 2 children. I've been through pain. Physical pain is so much easier to bear than what I feel on the inside at the moment.
Yes, sometimes the mental pain can hurt worse than a physical pain.
And I feel like a bit of a fake as well because I'm having all this mental trauma and physical pain, but on the outside, to anyone looking at me, I look fine. It's only the people who were actually there at the accident that really realize just what happened. I just want to be normal again. But I know I have to, and I know that every day it's going to get better. It's going to become a distant memory. People have gone through far worse. I just have to mend my mind.
Okay. So do you feel ready to work on this, Joanne?
Yes. Okay.
So what we're going to do now is a memory processing exercise that should help you make what happened a distant memory and might even help relieve your pain. How does that sound?
That would be good.
Would you like me to explain how it works, or would you just like us to get on with it?
Just get on with it.
Great, okay. So just to start with, what I'd like you to do is bring up the worst aspect of what you remember about the accident. The truck pushing you and you screaming and thinking you were going to die. And notice the feeling in your body, the fear and the pain. And now just listen to the tones and let whatever happens, happens. Just noticing. That's it. And what are you noticing so far?
I can breathe.
Good. Just notice that and keep noticing. And what do you notice now?
I became really aware of my body, and I realized that I was really clenching my fists and everything. And then I just made my body go relaxed. Then I stopped thinking about the accident. I'm not really thinking about anything.
So your head went sort of blank. Good. And what did you notice happening to the feelings in your body, the feelings of anxiety and pain?
That went away when I relaxed.
Good. So what do you notice about how you feel now?
I feel a bit more relaxed. I realized that out of the 100 cars that were driving along the freeway in front of and behind me, and how that truck was nowhere near me when I drove onto the freeway, that it was meant to happen to me for whatever reason, and that I was meant to walk away from it. So I have to process that in my head.
You look calmer now.
I feel calmer.
What do you think of that?
I'm very happy that I feel calmer. I haven't had any sense of calm.
Great. So if I ask you to think of the accident again now, how does it seem?
I'm calmer. It seems like it happened in the past, not something that is happening now.
And that statement, I'm going to die, how does that seem now?
It didn't happen, so I'm not.
And the pain?
There is no pain right now. I actually feel like I've taken a Valium. I just have to keep like this.
You will, Joanne, you will. Because the memory is processed now, physically and mentally. So you can enjoy living in your body in the present, where the past is in the past. So just to finish up, what do you notice when you think of the accident now and that thought, I'm going to die?
Right now, I can't even visualize it.
And what does that say about you?
I survived. I'm okay. It's over.
So I was just wondering how things have been.
I haven't thought about the accident at all. I felt calm, like my old self. The pain is completely gone. I've been sleeping like a baby, and I have even stopped taking all medications. It just feels like it's all in the past now. Thank you so much.